You're watching Cox Connections only on Cox 11. Established in 1998, Children's Health Investment Program, otherwise known as CHIP, offers a continuum of services that are tailored to meet the needs of all parents with children's ages 0 to 6, as well as prenatal women. Here to talk about the statewide program and how it's making an impact on the children and families it serves is President and CEO of CHIP, Trish O'Brien. Thank you for joining me, Trish, on the show.
Thank you very much for having us.
Let's start with the motto, CHIP's motto, a healthy community begins with a healthy child. Talk about the motto, the mission in terms of CHIP.
You know, we really see an investment in children as a way to make sure a community is vibrant years down the road. And we know that starting early is the best return on investment that a community can have with a child. So we want to make sure that every child is empowered to just have a very fulfilling life and reach their full potential. We want to make sure they're healthy and they're ready to enter kindergarten, ready to learn and succeed, and then enter the workforce as very productive workers and members of our community.
Now, I understand CHIP is a statewide or part of a statewide network. Talk a little bit about how many communities, how many localities are being served by the program.
Yeah, CHIP actually started in the Roanoke Valley about 30 years ago now, and it was replicated throughout Virginia. We now cover 39 localities with 6 hub offices throughout the state.
You have a home visitation and case management programs. Which program, I guess, do you see as kind of the cornerstone of CHIP?
Well, our home visitation really is our case management program. And that truly is the cornerstone of our agency. That's the program that is replicated across the state. It's done with a team. It's a parent educator and an RN that go out and they work with the family to meet all their health needs, work with them on whatever social issues they might have, and provide, the best parent education that we can provide through parents as teachers. And it really is giving parents tools to be great parents, because everyone, when they have a child, wants to be a great parent. And that's what we're helping them with.
Someone listening to this may say, well, why is that necessary? Why do we need to have somebody visiting a parent? Don't parents know how to be parents? And you and I both know that's not the case, but talk a little bit about that.
When you have a child, the old thing we say is, children don't come with instruction books, and they really don't. And every parent goes home from the hospital with questions, or it comes up in year 1, year 2, year 3. And we want to make sure that our parents are equipped to deal with everything that comes along, and that they can provide the best nurturing environment for these kids. And that's really what CHIP is all about, making sure the parent's the first and most important teacher for a child. And we are just giving them the tools to be that.
And again, this is a team. It's an RN, so there's a medical component.
Right.
And then you mentioned that there's a
parent educator.
Talk a little bit more about the parent educator.
The parent educator works with the Parents as Teachers program, and they provide developmentally correct activities for the children and teach the parents about development as we go along. So we know that often a case of child abuse is the result of frustration on the level of the parent, because they're not sure where that child should be at that particular age. So we're educating people all along that your child should not be sharing at 18 months old. That's not part of their makeup yet. So there's no reason to be frustrated.
So actually you're dealing with 2 generations. You're dealing with the child, but you're dealing with the parent as well.
Yeah, CHIP serves 2 generations at a time. And so we're promoting self-sufficiency for the parent, and then we're working with the child to make sure that they're getting a healthy start too.
Talk about your Sleep Tight program.
Sleep Tight is a program that is done here in Hampton Roads. One of the beauties of the CHIP model is that it is very nimble and is able to react to community needs. In Hampton Roads, we have an issue with infant death, unfortunately. And the number 1 cause of infant death between 1 week and 1 year old, according to the Virginia Department of Health, is unsafe sleeping. So we at CHIP Southampton Roads started a program called Sleep Tight. We've been running it for about 4 years now, and it provides cribs for low-income families, and an education about how to use a crib and safe sleeping.
So sleeping on your back instead
sleeping
of
on your back
stomach.
in a crib, not in bed with mom, not on a sofa, but in a crib.
Things you would think people would know, but people don't know.
People don't, or they just can't afford a crib.
We only have about 30 seconds left. What is it that you would want someone to know about CHIP that's listening today? How can they help? Anything, I'll give you the last word.
Okay. I think what I really want people to understand is that it may not be your child, but they're all our children.
Yes.
And that this is an important program for the entire community. And there are lots of ways to reach out and help at CHIP. Please call us, visit our website. If you have a desire to help, we're going to find the right niche for you to help us with.
Trish, thank you for all you're doing for
Thank
our
you.
children.
Thank you.
Thank you. When we come back, the safety of our customers is one of our top priorities at Cox. Hear how we are helping to help families stay safe, especially in their digital lives. We'll be right back with more Cox Connections.